found your solution with Health Hour. Every Saturday at 11 a.m. This is your space where Caribbean and African healthcare professionals speak about health with a focus on Black people. We tackle the topics that keep you up at night: mental health, chronic conditions, preventive care, sexual health, men's health, women's health, heart disease, and much more. All with the cultural context that matters, because our Black doctors understand the unique challenges we face. Here is what you can expect: real talk from doctors who look like you and get it, lived experience testimonies, practical advice, illness prevention and management tips, and a space of understanding without judgment. You also get to ask questions. Your questions drive the conversation. Health Hour, where community meets Black health expertise.
Good morning, everybody. I hope you're enjoying. For me, it's a sunny morning on the 13th of December, 2025. My goodness, I'm a time traveler. I am your host this morning, Dr. Ayo Olatoye. I am many things, but primarily I am a Christian husband, father, brother, and as a hobby, I'm a consultant in acute medicine. I hope you guys are excited like me. It's almost Christmas, 12 days, right, before Christmas. So we have our Christmas tree, we have our lights, we're excited. Who's excited for Christmas? Those of you who are celebrating, I hope you are as excited as I am. It's going to be a fantastic time. Now, today we are going to have a really, really important session. You know that the Khan Health Hour, the Black Health Hour, is positioned by our seasoned Black professionals to come to you with up-to-date, fantastic information. Today is not going to be any different. My son is pretending to be invisible. We can see you. So today is no different. We have a really important person who I'm going to introduce, who's going to talk to us about women's health and the hormonal changes that women have as they get older. It's interesting because my wife and I have been talking about this anyway, and I think it's a very relevant conversation for women to be equipped, but also for men, the husbands. We need to know as well. So I am so excited to hear this information. Our speaker today is many things, but she goes by Dr. Itunu, let me get her surname, someone's got it for me. Itunu Johnson-Sogbetun. Please forgive me if I said that wrong. She is a general practitioner in the London NHS service. She's also an international speaker. She's also somebody who has a special interest in women's health, and she's the founder, would you believe, of the Dr. Show Cares and Heal for Black People. So it's not small fry. We have somebody who is very, very knowledgeable, who's going to give us a fantastic session on women's health as women get older. So Dr. Itunu, thank you so much for coming. We are so excited. I'm excited. Please, without further ado, take it away.
Thank you, Dr. Ayo. So lovely that we're actually having a man as co-host today, because this conversation is so important, because not only does it impact women, it also impacts men, because we're inextricably twinned, aren't we, as people in this world. So thank you for that introduction. I'm just going to share my slides. Oh, that's not what I'm trying to share. Can you see my... Can you see my slides? Good. Okay, so women's hormonal health. It's a big topic. So we're just going to fly through and then see where we're at in questions. It's really important. I think increasingly, I do all of women's health. It's really important to me. I love women's health. But I think more recently, I'm a menopause specialist. But more recently, I've really been very interested in how hormones change through life and impact our health. and specifically how that impacts us as Black women. So Dr. Ayo introduced me. I've got all these titles. I do all these things. But I'm a menopause specialist, but I'm also a wider committee member of the Primary Care Women's Health Forum. I do EDI, I teach, but most important on this slide is that it's really about personal insight with professional expertise. So I'm not just talking to you as a doctor. I'm also talking to you as a woman who lives with hormonal challenges with my own health. And this is part of why I'm a dedicated advocate for health equity. Right. So why is this important? Because hormonal changes impact us through every stage of life, from puberty to menopause. And Black women are at higher risk of certain conditions with worse symptoms, yet these issues are often underdiagnosed. And also, there's misinformation and cultural stigma. And I'll share my story at some point today, which can prevent us from seeking hormonal care and can lead to unnecessary suffering. And there's a lot of fear in our community, understandably, because things have been handled so badly. And so I'm hoping that I'm going to be able to do a whistle-stop tour, we don't have very long, and talk about hormonal imbalances throughout a Black woman's life. So just have a look at this diagram to show what hormones that we have. Have I been muted this whole time? I'm so sorry.
No, I can hear you.
Oh, okay.
I
I
can
was
hear you.
like, have I been muted? Okay.
No, I can hear you.
Right. Um, so this is a picture of our endocrine system, and there is the hypothalamus, which basically sends signals to our pituitary gland, which controls the function of all the endocrine glands in the body. And so in our necks is our thyroid gland, which is really important for metabolism and energy. We have our parathyroid, which sits beside the thyroid gland, which regulates blood calcium. Then there's the thymus, which helps with our immune system. There's the pancreas, which you would have heard of because it helps produce insulin, which helps control our sugar levels. And then we have the adrenal glands, which produces our steroid hormones, the corticosteroid hormones, adrenaline, which also produces cortisol, and the mineralocorticoids, which help our metabolism, our immune system, our blood pressure, our response to stress. So very important, the adrenals. And then, of course, we have our ovaries, which produce the reproductive hormones, so estrogen, progesterone, and a little bit of testosterone. Now, the adrenal glands also produce a little bit of testosterone as well. So this is a kind of whistle-stop tour through our hormones. Now, estrogen, even though it's a female hormone, it's not just about reproduction. So yes, it's important for our menstrual cycles, but it also impacts everything in our body, from the top of our heads and our brain. There are estrogen receptors for mood, memory, temperature regulation, libido, which is our desire for sex. It helps with our heart health, so with cholesterol control, with our blood pressure. It helps with our skin health, helps keeps our skin nice and healthy, helps keep our hair nice and healthy. It helps with our bone health. So estrogen is a very, very important hormone for women. It's not just about reproduction. I think that's important to understand. Now, progesterone helps support balance the effects of estrogen, so quite important, but it also helps relax us. And can make you feel sleepy. And it can help you feel more relaxed. And it also regulates the menstrual cycles. The follicular, the FSH is all about egg production and menstrual cycle. The LH triggers ovulation, and this is all part of reproduction. Now, we talked about testosterone, which is present in small amounts in women, but it's important because it influences muscle strength, libido, and energy levels. Now, we have cortisol, which is our, the big dog. It's our stress hormone. Very important. So you need some cortisol. But excessive cortisol can really wreck our bodies and impact our metabolism and make us feel not great. Our thyroid hormones are really important for metabolism. So often, it can be underproduced or overproduced, and that can cause actual significance in energy levels, weight management, and all sorts of different problems that you can get from your thyroid being dysfunction. Now, insulin is all about regulating blood sugar. So if you don't have enough insulin, so you can have diabetes, or if your insulin is not responding, there's two types of diabetes. So the diabetes where you're not producing insulin, usually because of an autoimmune thing, which is type 1, and then you've got type 2, which is that your body's not responding adequately to the insulin. But you've also got insulin resistance that can happen in people with metabolic syndrome, in women with PCOS, and we're going to talk more about this. There's prolactin, which is a hormone to support breastfeeding, and oxytocin, which is the love hormone, which helps with bonding, childbirth, and stress relief. Okay, so our hormones are always changing throughout life, especially as women. We live in a square world and we are circles, women. We are constantly changing. The world is trying to force us to fit into a book. But I think if you understand your own hormonal changes and what your hormones are part of life and how your body grows and adapts, it can help you understand your body and manage your health better and actually create your own environment to help you thrive better. And that's the reason why we talk about this. Now, every stage from the first period, which happens, we call that word menarche, all the way up to menopause and beyond, because life doesn't stop at menopause, has its own patterns of ups and downs. And we'll be looking at these phases to help us see how hormones shape life and what can be done to balance. Now, I'm going to be talking about your reproductive cycle. So you start your periods and then you begin this cycle, which happens roughly monthly. So it's average of 28 days, but some people have shorter, some people have longer. Anything between 21 to 35 is well within the limits of normal. And you have your follicular phase, which is primarily estrogen led, and you've got estrogen. So it starts with your periods, and then you get estrogen surge and you're feeling great. You've got lots and lots of energy. It's a great, great time. And then you've got ovulation, and if you don't get pregnant, progesterone starts to become the dominant hormone in the luteal phase. And for a lot of women in the luteal phase, you might feel, a bit more tired, a bit more like you need to just care for yourself, a bit more vulnerable, possibly. You just have to be a bit more self-caring in that time. I think it's important to understand these cyclical changes because that can help us understand ourselves as women. Both are important. Neither is worse than the other. But we need to think about how we protect ourselves and protect our energies, and maybe even think about how we plan our lives based on our cyclical changes. And this is the normal cyclical changes. There's nothing wrong with it. It's how we are and as women. Now, as I say, at puberty and adolescence, menarche begins. And for those of us who remember what that was like, or who are having young people in that phase or might be in that phase ourselves, your hormonal changes begin. And that causes, physical body changes, your widening hips, breasts develop, body fat, you start getting that slimmed waist, bit more hips, all of those things. And then you have your first period, and your periods, it's normal. It can be normal for it to be regular at first, but it should settle. If it hasn't settled after about a year or so, or you need to try to see a doctor to see what might be going on. But it can take a while for the for the periods to settle. Now you can also get mood swings and emotion, and it's quite interesting because often you have in the house a young person going through puberty and maybe a parent going through perimenopause. It's quite interesting to see that dynamic because both people are going through emotional and mood changes that can happen with with the hormonal changes. And I think it's often a good time to reflect and have these conversations. Let's not just call them angry. Let's explain to them that their body is changing, what's going on in their body, and actually some of the emotions that they're feeling, the low mood or the irritability, is actually to do with their hormones, and they're just more sensitive to what's going on in the world because their hormones are changing. And of course, it's a really pressure time for our young people. So let's be kind and supportive, as I know we are anyways. So as I say, the menstrual cycle, it starts with menstruation, where the uterus sheds the lining, then you get your follicular estrogen phase, and then ovulation occurs. If you don't get pregnant, then you get the luteal phase, and ultimately it starts again. When there's no pregnancy, the womb lining starts to shed again, and there you go, the cycle continues. So how might you feel? So we talked about this. During your period, you might have a bit of cramping, you might feel a bit of discomfort, you might feel a bit not great. But as soon as the follicular phase and the rising estrogen starts, you might feel a lot more energy, as I said, and it helps with your clearer thinking and improved mood. And then you might have feel more confident as you're kind of going through that ovulation uplift. You may feel more vibrant and more attractive. Just be careful, because obviously it's a high risk of getting pregnant at that point. And then you get the luteal phase, which we've discussed, but the intensity, and I think this is the main crux of this slide, can vary widely and can be influenced by overall health, stress levels, and lifestyle. Now, what are the problems that you can have? We talked about the irregular periods can be normal, but if it extends, then that needs to be looked into. If you're having severe cramps, you need to have that checked as well, because you can have primary dysmenorrhea, which is primary painful periods, which is due to high prostaglandins, quite common in Black young women. If it's impacting your ability to go to school or to go to work for for sort of teenagers and adolescents, that's a problem, and you need to see a doctor. And then, of course, it can be associated with conditions like endometriosis, adenomyosis, fibroids, and you can get more severe cramps. Now, you can also get acne and oily skin and breakouts because of the hormonal changes that are happening. And of course, PMS, which is, really struggling with that luteal phase, which can be a mix of physical and emotional symptoms, so mood swings, bloating, fatigue, so in that last 2 weeks of the cycle. So for some women, it can be really impactful, and again, in some women, you even get PMDD, which is premenstrual dysphoric disorder, where some young women feel suicidal, really depressed in that just those 2 weeks. You need help. Don't suffer in silence. Go and get help, because there is help for all this stuff. And of course, talking about it more, you can have cravings, appetite changes, but just be careful that you're giving your body the right things. Because even if you're craving salty and sweet food, actually, I mean, some of you might have experienced it. You have a chocolate and you can literally feel like 2 hours later, your period becomes much more painful. So give your body what it needs, not necessarily what it's craving, which is good food, wide variety of fruits and vegetables, good protein, and gentle movement. All of these things can help. And of course, you can get the mood changes that I mentioned earlier, the irritability, the anxiety, the low mood, and of course, the physical symptoms as well, with the breast tenderness, the bloating, the headaches, and all of these symptoms. Now, as the years go by, you get into that cycle, you fall into your pattern, and then, of course, you may decide to get pregnant, and we haven't gone very in depth into kind of pregnancy in this talk, but there's the postpartum changes that can happen after pregnancy. So women can have really strong issues with low mood, joint aches and pains, vaginal dryness, all sorts of brain fog, all sorts of symptoms that kind of almost mimic what happens in perimenopause in the postpartum period. And again, if you're struggling, you do need to go for help. But then in our mid-30s, fertility starts to decline, and then that leads to irregularities in our cycle length and changes in our cycle length, and that can lead to perimenopause, and we'll talk about that in a few slides time. But during those reproductive years, there are quite a few female health problems that can impact us. So we know that fibroids are more common in us Black women, and they can cause heavy bleeding, pain, and fertility issues. We've talked about this in depth this year on Health Hour. And we talked about polycystic ovarian syndrome, which is not just a reproductive health problem, but actually also impacts our metabolic health, our mental health, and is often more heightened in Black women and can be underdiagnosed. And this can cause irregular periods, irregular cycles, and also can cause problems with infertility as well. Now, endometriosis, which is an issue where the womb lining grows outside the uterus, can cause chronic pain and fertility challenges. A similar condition, adenomyosis, is when you've got uterine lining tissue within the walls of the uterus, and again, both of these conditions can cause pain and lots of discomfort for women, and the diagnosis is often delayed in Black women. Then don't forget about infection, because infection can cause long-term pain and problems. So if you are in a regular relationship, you should check, you should go for a sexual health screen before that relationship. If the relationship unfortunately ends, you should go for a sexual health check after the end of the relationship. But if you're not in a regular relationship and you're just having casual relationship, then you should go for a sexual health check at least once every 3 months, because of, if you don't check, you won't know. And if you don't know, that can really impact your health. If you have any potential concerns and you're, trust but verify, we know that the reality is, then sis, please do your checks. Yeah. It's not about living with the long-term conditions of pelvic inflammatory disease, which can really impact pain and fertility problems. But it's also important that we're doing our cervical screening and making sure that any abnormal bleedings, that's bleeding in between periods or bleeding with sex, is reported, because that could be a sign of womb cancer. Another issue that is, or cervical cancer, another issue that is really important to pick out. Now we go into the transition period, and then we go into perimenopause, when the hormone levels begin to change. And as estrogen drops, you begin to get symptoms such as hot flashes, sleep problems, mood problems. And of course, it's unique for an individual because the timing and intensity varies from woman to woman. And menopause is that time in a woman's life when she hasn't had a period for 12 months, which is marking the end of her fertility. Now, hot flushes, we talked about some of the symptoms: hot flushes and night sweats, mood problems. Now, sleep can also be disrupted, and that's really important because sleep is so important. Now, early menopause, this is menopause between 40 and 45, is really important because we as Black women can experience this more commonly, but it has implications for our future health. So early menopause increases your risk of heart disease, increases your risk of bone density loss and osteoporosis, increases your risk of dementia, increases your risk of sexual dysfunction, increases your risk of genitourinary syndrome of the menopause, and that all of these things can really reduce the quality of life. So you really want to see a doctor if you've got early menopause, because hormone replacement therapy is strongly recommended. And of course, primary ovarian insufficiency or early ovarian failure is when the ovaries stop working before the age of 40. And this is more common in Black women as well. And this again means that, so this is even earlier. And so the same risks apply. And so you need to see a doctor, because and this can be very difficult for women, because especially if you've not had your family, and we know in our cultures, many of our cultures, there's a huge prize on fertility. Some women might feel stigma trauma. And I think it's so important that you have the right support, you see the right specialist to really help you during this time. And so, yeah, really, really important because of the future health risks. Now, internal versus external hormones. So far, we've been talking about the internal hormones, but there's actually external hormones that you can get. These are hormones from medications such as contraceptives or hormone replacement therapy, and they're used to help support or adjust your natural hormone levels when needed. And I think it's important to recognize that external hormones aren't necessarily bad. And I know in many of our cultures, no, I don't want external hormones. But if you are being recommended that, you have to really think about whether it could be helpful for you. And I'll share my story. So, as I've mentioned on previous talks, I've got PCOS, but actually when I was young, I had really, really painful and heavy periods. It was so bad that I missed days of school all the way through secondary school A levels. But when I got to university, the same thing was ongoing, but this time I was in medical school. And so missing out days actually meant that I got into trouble because I was, my attendance wasn't sufficient. And so I was literally going to be failing out of medical school. And of course, I'd been to the GP and I'd tried all the pain medications, the mefenamic acid, tranexamic acid, but it hadn't worked sufficiently. And the doctor, my GP, had offered me the pill. But when I'd spoken to my mom, she'd be, you can't go on the pillow. It's going to impact your fertility in the future. No, God forbid. So I was scared, right? And I was worried about my future fertility because of the pill. And because even though I was a medical student and I had some knowledge, I was still, the cultural factors, I was still scared. And of course, it was at that point where I was failing. I was taken to see the tutor, the medical school teacher, who fortunately happened to be a gynecologist. And so she asked me, what's the problem? And I said, it's my periods. They're very, very difficult. And she said, why don't you go on? And I explained to her, and she said, why don't you just try it and see for yourself? And it was completely life-changing for me. I went at the time on the progesterone-only pill, Cerazette, and honestly, I had no periods. And it's the reason why I was able to, I started thriving. I ended up in the first quartile of my year group. I did so well in medical school and I was able to fulfill my potential, which could have been cut short because I was too scared because of external hormones to help me with my period problems. But again, also so many young women get pregnant, because they're not using contraception, or we're too scared to help them protect themselves from pregnancies that are not at the right time for their lives. And of course, there are irregular problems like PCOS, where there are hormonal imbalances, and actually hormonal medication can help calm down those hormonal imbalances. And in conditions like endometriosis and adenomyosis, hormonal treatment can help calm down and quieten the condition so that it's not worse and causing infertility problems in the future. It's in not using the medication that it might even then cause for infertility problems in the future. So are we getting the right information? Are we getting our information from TikTok or from people who don't know what they're talking about? Or are we getting the right information from doctors and nurses and other healthcare professionals who know about these things and who can give us the right advice? Of course, hormonal treatment is not right for everyone, but in certain circumstances, like in my circumstance, it was the right thing to help me achieve my potential and get a better quality of life. Now, of course, in perimenopause and the menopause as well, HRT, hormone replacement therapy, can be so useful for the quality of life symptoms, and also for those who are going through early menopause, preventing some of these complications that we've talked about. But you always need to consult a healthcare professional to make sure that whatever you need is right for you, because it's always a personal conversation, but it's a meeting of two experts. You're the expert in your own body, and the doctor is the expert in the medication, and we can have conversations. No one should be forcing anything down your throat, because we know that it's a meeting of two experts building trust. because we understandably have a lot of hormonophobia in our community. There's been historical distrust, past abuses, unethical research, misinformation. We get, when you get these long WhatsApp messages that are literally from some aunties telling you that, this medication or whatever is going to disrupt your life, and we're forwarding it without even thinking, is this true? Where's this information from? And then, of course, there's cultural beliefs as well that might not necessarily be true, but also sometimes it's also about cultural norms, religious views, about, why would you want to use external hormones? Sometimes, if it might be necessary, as I've explained. And so it's important that we have an open mind. Our natural hormones are beautiful, as I've explained before, our cycle, but sometimes they come in the way. There's abnormalities that come in the way of us living a healthy life. And we need that external hormone help. And in fact, historically, the three most important things that influence the quality of life for people in the last century were, one, immunizations and vaccinations, because believe it or not, in the last, before the last century, 25 to 30% of children died before the age of 5 because of childhood illnesses. And so vaccinations and immunizations really changed the trajectory of that. Then also antibiotics, because believe it or not, before the advent of antibiotics, you'd get an infection, you could die of pneumonia, you could die of a urine infection even, and all of these things. Similarly, hormones meant that women could have better quality of life. They didn't have to be burdened with unwanted pregnancies. They could have better periods and all of these things. So we forgot, and it meant that women could then go into the workplace and reclaim their place as equal members of society. We've forgotten a lot of that historical context. But again, a lot of the time you're not having a conversation with someone who understands your context. There's limited culturally competent care. And that then means that conversations about hormones, whether it be internal, external hormones, are not had appropriately. And then, of course, there's underrepresentation in research. So what can you do? You can educate yourself, get information from reliable sources, empower yourself if needed, to get hormonal treatment to help your condition. Go to see a trusted provider. Make sure it's an open dialogue, a meeting of 2 experts, and get support from your community. And then you need to understand your own hormones. Learn the basics so you can know if something is going wrong. Understand your cycle, track your cycle, keep a record of moods, symptoms, physical symptoms that are happening, physical changes. Learn your own hormonal fluctuations so you know how to understand your own body, how best your body works. As I said before, educate yourself, recognize what's normal versus what's concerning. And this slide just really shows you what can be normal. So with your skin, you can get mild sort of cyclical breakouts and that's, oh, sorry. I'll just talk about it. That was the wrong slide. I apologize. So normal, you can get sort of mild breakouts, and it's manageable with some skincare. But if you're getting severe acne, that's not normal. But again, with your moods, you might get sort of mild irritability. You just need to be more self-caring with PMS, or you're especially during that luteal phase, and that can be normal. You just need a bit more self-care and self-love. But if you are really struggling with depression, if you're not able to go to work, you're feeling suicidal, you're very anxious, it's interrupting your quality of life, then that's not normal. You need help. If you are having sort of mild pains, you take an ibuprofen and it's settled, it's not disrupting your ability to work or to go to school or any of those sorts of things, then that can be normal. But if you're getting severe pain, you're having to miss days of school, you're having to miss work, it's really impacting your quality of life, then that's not normal. normal and you need help. If your cycles are irregular, so normal, as I say, can be between 21 to 35 days, but if you're having cycles that are shorter or much longer than 35 days, you're missing periods, you can have the one-off, but if it becomes a regular thing, then you could have PCOS or other hormonal problems with your thyroid or with prolactin. You need to go and see a healthcare professional. So you need to know what's normal so you can know what's abnormal, and then you can go and get the help that you need. So how do you navigate your hormones? I've talked about self-care. You need to stay active, eat the right foods, time in nature. Nature is so important for boosting your mood and easing stress. Keep well hydrated. Get support from family and friends, and organize your day, your week to match up with your symptoms. Don't go and put something really heavy when you know you're going to be dealing with some PMS, heavy PMS symptoms. So in summary, I know this has kind of like been a whistle-stop tour. There's so much more that we can talk about, but we haven't got that much time. I think embrace your individual journey. Understand that your hormonal journey is unique. Practice self-care, stay informed, and get the right support, because together we can break barriers and uplift every Black woman on this journey. So I'm going to stop there and come back to you.
Wonderful, 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 wonderful. Thank you so much, Dr. Itunu. Again, a wonderful, as expected, a wonderful conversation about the hormonal stages of women. So thank you so much. Now, I have a few questions. We have some questions you can chat, but I wanted to start with, so it might just be me, and I'm not like on social media like that, but it seems like there's almost a war between men and women in terms of conversation. Have you noticed that in your practice? And how do you think that affects the women accessing the help that they need because of perceptions from men?
I think that's important because, we're talking about young men, particularly, watching some of these people on social media or listening to podcasts and things that cast women in a negative light. One of the things that I said at the beginning is that we as women are circles, and we're living primarily in a square world that's created primarily by men, for men, and we are having to fit in and kind of create our own spaces. And as I described, our hormonal issues, I haven't even talked about the mental load that women carry for society disproportionately. We're still the primary caregivers for society. We're still the primary burden bearers in terms of caring responsibilities for the young, the old, the vulnerable. And now we're also equal partners in the workplace. No one's saying, oh, don't bring your 50%. It's rare anyways. Many women are having to also bring half of the financial, sometimes even more, as in many single women households. And they're still having to do that with all of those caring responsibilities. So yes, the pressure on women is a lot. And of course, I'm not saying that men don't have their own challenges that they're dealing with, but I think we need to understand each other and understand where things are coming from. Now, men historically have had the upper hand in a paternalistic society, and there's been a lot of misogyny, so sort of treating women as second-class citizens. And of course, women have fought back on that, and that's where a lot of the clash is coming from, because sometimes now men are feeling, oh, women are too powerful, which is not even true. Men still primarily control society. But women have gotten more power, and for some men, that's something they don't even want to see. And that results in clashes. But I think we have to think about it. We're both very useful. We have different positives and different negatives, in as men and women. Understanding our hormones, understanding our cycles as men and women, understanding how women cycles operate, how women's hormonal journey operates can help men understand how women fit in. So we need to be supporting each other because men also have their own struggles. There's a lot of, especially for young Black men, think about that. I'm raising a young Black man. My son is a boy, he's 7. I want him to be able to own space, to be able to be a thriving member of society, to have good role model. So it's important that we're encouraging and empowering our men, but we also don't want to do that at the detriment of our women.
Absolutely. I think it's like you say, it's important for us to encourage the conversation because ignorance, um, prejudice and bias and all these things thrive in ignorance. So and sometimes the conversation can challenge. Oh, I didn't realize that that's something I thought, and I think it's important, like you said, there's two sides to every coin. It's important for us to understand where everybody else is coming from. Now, we have a question in the chat. It says, what do you recommend to perimenopausal or menopausal women who can't have HRT due to a history of cancer to maintain the health of uterus, womb, ovaries, bladder, etc.?
So, women who have perimenopause and menopausal symptoms who can have HRT, there's a whole host of non-hormonal treatment options. But again, the lifestyle factors are key for all women. So this is what are we eating, what are we putting into our mind. So are you just consuming social media and the 24-hour news cycle and lots of things? What are we putting into our mouth? So what are we eating? Are we eating healthily? Are we moving our bodies? Are we getting that social, are we having fun? Are we laughing? Are we getting that social support that we need? Are we spending time in nature? Are we managing our mental load? Are we learning to say no instead of just carrying and packing things on top of each other with a heavy, heavy mental load? So all of these things are really, really important. But as I say, they're non-hormonal medication options. But there's other things that you need to be doing. You need to be doing or thinking around going for your regular health checks. So making sure that you do your 40 your NHS health check once you're 40, and so checking things like diabetes, blood pressure, cholesterol, going for your cervical smears when you're called. Once you're 50 on the NHS, they'll check you for your mammograms. Go for these things. They send you your bowel screening, do that. All of those things are really important in being proactive. If you have the ability to access private healthcare, you can even start some of these things sooner. So again, all of these things are really important. And then if you notice any abnormal symptoms, that's why I said it's important to track your own normal. If you notice, I'm having bleeding or spotting, I wasn't having it before, or you stopped having your periods and then after 12 months and then you start having bleeding again, that's postmenopausal bleeding. You need to go straight to a doctor to get checked. So again, or if you're having bleeding in between sex, you need to go or in between periods, you need to go and get checked. But again, there's all these things that you need to do to keep your health and wellness. And you can speak to a menopause specialist like myself or others, or get referred on the NHS to a menopause clinic for advice on the non-hormonal options for menopause treatment. But then also supplements can be helpful. So make sure you're taking vitamin D, calcium. If you're not getting enough in your diet, some supplements, things like magnesium, evening primrose oil, can be helpful. But again, we don't have the evidence base for them. So if you've tried them and they haven't worked, I'd say give everything 3 months. If it hasn't worked, then you can stop. But you can try some of these things as well.
Yeah, I think it's really important, and one of the things I'm always impressed at during the Can't Health Hour is the encouragement to shift the responsibility back to you, the community, because it's your life, So, spoiler alert: those of us who are doctors and working in the NHS, actually, it's maybe difficult to swallow, but it's not our responsibility to make sure you live a healthy life. Our job is to come and advise you when you come to us and say, I have a problem, okay, maybe do X, Y, and Z. But I always say, informed is armed. I want to encourage everybody, like Dr. Itunu said, know your normal. Actually, what's my cycle like for me? How often do I, when I bleed, how many days, how heavy, how am I feeling? All of these things, because then it's useful to be able to say, actually, this is abnormal. We even actually, to be fair, we say it to medical students. When medical students are learning, one of the things that we say to them is examine a lot of normal first, because then it becomes easy. Even if you're not able to identify what the abnormality is, you'll be able to say this is not normal. Does that make sense? So please, everybody, when it comes to your health, for, in the month, when is a week that people need to treat you differently? When, I mean, if you're married, is there a conversation you need to have with your husband to say, actually, on these days, can we talk about what would really help me in terms of my dealing with my difficult periods? And as a husband, that's a conversation I can have, babe. Um, when would be a good time to have a conversation about how I can help you deal with your heavy periods or your painful periods? Um, Another conversation I wanted to talk about is, so again, this I'm interested in the thing between men and women. Again, please understand this in the spirit of what it's meant. So as a man, I am dealing with my wife or the women in my life who are dealing with a challenging time because of PMS or this and that. So this is the way that men's brains work. So from a responsibility point of view, she snaps at me. Is it hormones? Is it like how much is do I encourage my wife to say, well, because I can imagine it's not helpful to say or snap out of it, So how would you help frame that conversation if a couple came to you with that difficulty?
So I think firstly, it's all about mutual understanding because it's never one thing. I often talk about the biopsychosocial. So of course, the hormones predispose to irritability, to anxiety, to low mood or mood swings, to not feeling great, sort of bloat, especially with PMS, like bloating. Obviously, with perimenopausal symptoms, we say there's almost 75 symptoms. So women themselves are trying to understand what's going on in their body. But then there's other things, there's other factors at play. So psychological factors, like, maybe there's a stressful thing going on, or maybe they're coming to terms with the change that's happening in their own body and they're feeling more vulnerable because, they're feeling like their brain fog is really impacting their ability to work or function in the home. And then maybe they're carrying a lot. So, they've been used to doing all the thinking for you. And so, yes, you may be helping with the doing, but they've been the one telling you the thinking or doing all the thinking so that you can do the do. Um, and so sometimes it gets a lot harder with the mental load. Um, and of course, somebody's mentioning about, women feeling they have to be strong. And, all of these complex things with our culture, or the strong Black woman. And she's feeling, no, I can't do this right now. Right. And it's all those things mixed together. So you, as the man who is in that, has to understand that this is really complex and it's often just not one thing. So maybe you can help with a little bit of the thinking. Um, and so that she's not having to carry all that thinking load to help her with managing the symptoms. And again, it's all about communication, because expressing, you can say, oh, because it doesn't mean she doesn't have responsibility for her behavior. Just because there's a reason for it doesn't mean that people have the right to be rude or disrespectful or to each other, because men, I don't think
Yeah.
there's mutual respect. It's not one person is, it's not like, oh, the man, you need to be respectful to me. I mean, that's nonsense. It's about mutual respect.
Yeah.
So it's how do we speak and communicate to each other and treat each other with mutual respect and appreciation for what each person is going through. I think the understanding that it's a lot more complex than just only the hormone, but it's also what's been going on. How much support have you been providing before? Now she's not able to do maybe what she was able to do, particularly in the perimenopause context. Are you able to step up?
Yeah, so first off, Dr. Itunu, I don't appreciate you speaking to my wife about our bedtime conversations and you exposing. No, but jokes aside, no, but so these are the conversations that we're having in our home in terms of like the mental load. My wife will often say to me, just exactly the words that you're saying. I'm thinking about these things all the time. So when you ask me, oh babe, where's the remote? Like that's another that's another load that I am having to carry. So men, I'm speaking to you as a man. Um, there is this is my belief that I believe that I am tasked with creating a culture in my home where everybody has an opportunity to feel loved, safe, and flourish. That's my responsibility. So therefore, if my wife is struggling during her period times or other things, my job is to provide a way for that to be easier. Similarly, thing with my children, if they're dealing with something difficult from an emotional point of view in their teens, my job, again, not a task that I can add on to my job. My actual job is to create an environment where the conversations can be had, people can feel seen, and not just reactionary. And this is something that I struggle with full transparency, thinking ahead and saying, okay, how can I be of service before they have to ask. So men, please, we need to do better. We need to do better. So another question here. Sorry, it's been covered. Is there a connection between our hormones and heart health? What is the reason why black women have higher risk for things like high blood pressure and heart disease?
So absolutely, particularly with perimenopause and the menopause. So if you have earlier menopause, so all women have a worsening risk of heart disease after the menopause. So estrogen is heart protective. And that's actually another reason why HRT can be helpful, because HRT is also thought to be heart protective. So estrogen is heart protective. When we lose estrogen, then that increases our risk of heart disease. Estrogen helps keep our cholesterol low. So people will notice that in perimenopause, the cholesterol just jumps up. And that's, again, the blood pressure can jump up. And then also with estrogen, it keeps your waist nice and slimmer. When you lose the estrogen, then you gain weight, particularly around the abdomen area. And then you get more visceral fat covering the organs, and that increases your risk of insulin resistance, metabolic syndrome, heart disease, strokes, and all these other health problems. So actually, estrogen is protective. And so it's, we have to understand that's why early menopause and premature ovarian insufficiency is so high risk for women, because, I was listening to a cardiologist say it's an independent risk factor like smoking or high alcohol intake for heart disease, early menopause, or premature ovarian insufficiency. Do we understand that? And of course, as Black women, we're more likely to get early menopause. I mean, the average age of menopause in Black women is 48, 49, which is younger than the average age for white women. So we don't even have the data to fully understand what the ramifications are. We know that already we are increased risk of high blood pressure, and that has to do also with our kidneys, because we're more likely as Black people to develop high blood pressure earlier on in life. So by 40, 50% of Black people will have hypertension. And that's another issue, right? And then we are 3 times more likely to get diabetes, but Black women are much more likely to be to have obesity as well. So when you bring all of those things together, you can see that it becomes a really high risk situation. So we have to really understand our hormones, our risk. We need to be making sure that we're eating the right food. Again, it's the same thing, moving well. We're getting the support for weight management if we need it. We're getting the support to make sure that we are reducing the amount of salt, but it's not just salt. Let me put Maggi, let me put more no. Anyway, I can talk about this forever.
Yeah,
Go back to Dr. Ayo.
And one of the things I think is really important to think about is that, and I think it's great you've started to feel perimenopausal or menopausal. One of the things when I talk to men about men's health is that there is your body has memory. And there's a way, I think, of starting early to live a healthy life, so that when you start to have problems, you've built reserve. Because when you develop the problem, it's not the best time to have the best time was 10 years ago. So I'm just saying, with regards to our young women talking about their health, before you become perimenopausal, now is the time to think about, okay, what does eating healthy look like for me in my community? What does proper weight management look like for me in my community? I am aware that I'm a man. I'm just saying, please, let's just be honest with ourselves. It's not about fat shaming or anything like that. We want you to live as healthy as you can, as long as you can. And I think that it's important to start thinking about that early.
That's right. And of course, PCOS, so a condition that's a hormonal condition, which happens in younger women, increases your risk of diabetes, heart disease, all of the same things because you have that hormonal imbalance, which causes insulin resistance and metabolic syndrome. So that's why I mentioned, I mean, I gave the talk on PCOS, I think a couple of months ago. It causes metabolic, so it's not just in the perimenopause. Any hormonal condition that
Yep.
causes a hormonal imbalance for women, when you don't have the right balance, can cause these problems as well. So
So
very important to start
start
early.
early. Yeah, absolutely. Because it's again, it's not in the moment of the emergency. That's the best time to start. The moment of the emergency is the best time for your body to draw on your discipline of good health that you've had for the last 10 years, 20 years. A question here is, it's particularly bad for our communities when it comes to managing health issues to do with reproductive health. How do we push for better research and fairer treatment so doctors stop acting like one size fits all?
I think absolutely, we know we need better research.
Mm.
I mean, it was only recently that the National Research Council mandated that there be ethnic diversity in every single piece of research. It was only in the 90s that it was mandated that any women was included in research. So as I say, we are circles fitting into a square world, and when we're a black or brown circle, it's even more tricky. So we appreciate, and this is why we need to keep advocating. Organizations like Khan participate in so many different research problems. When you get the email, don't ignore it. Participate, because that's the only way we're going to get data, right? Um, Participate in research projects, but also advocate. There's so many different groups. There's APPGs, there's charities for different conditions. So whether it be Endometriosis UK or Verity PCOS, all these different organizations that advocate, or Prostate Cancer UK, or advocate for different health problems that impact our community, get involved, right? Make sure that the Black voice is represented, that they are also pushing for things that support our community as well. Don't be in a situation where they're looking, they can't find Black people to, I reject that, so I don't want to talk about it. Breast cancer, God forbid, breast cancer now, God forbid. I
Yeah,
can't join that though.
yeah,
No, let's not
yeah,
have those attitudes.
yeah.
Like, let's get involved. But then also, about that question about making sure that you feel respected, write down your thoughts. Sometimes take a friend along if you feel that you want to make sure that you're listened to. Make sure that if you haven't got the right answer, seek a second or a third or a fourth opinion make sure that you have someone you are listened to. Sometimes doctors feel rushed off their feet. It's a bad day. It's not always that they don't want to listen to you. Sometimes it's that it's been a bad day. But we know that there are some who just maybe don't understand and don't want to accept that and they don't send you to the right person. We know that all sorts of things happen. So make sure that you're advocating for yourself. Get a second, third, or fourth opinion, whatever is needed, to ensure that and remember that it's a meeting of two experts. Your opinion is really important as well.
So I think this is really important in terms of engagement. Engagement. We need to make sure that we are part of the conversation and not, I mean, we don't need to be asked for permission. We're part of the conversation. So like Dr. Itunu says, if there's an email, if there's a group, some of you might have emails even about like either not medical trials per se, but these peer groups and focus groups. Invite yourself there and have the conversation, because our voice needs to be represented, and it's not reasonable to expect somebody else to represent our voice in the same way that we can. So, Dr. Itunu, before we close, because this has been a lovely, fantastic conversation, is there one thing that you can advise everybody to do that you would say, okay, if you do this, you're a step ahead, you can move forward? One thing that you would advise everybody to do if they were to make a change?
I mean, for me, I think particularly as Black women, we're not kind enough to ourselves. And that means self-care and self-compassion, whether it means what you're putting into your mouth, what you're putting into your body, how much self-care, refusing to align with that strong Black woman, asking for help when you need it, being vulnerable, having communication to express your needs. I need help. Don't try and always power through, you know? Be kind to yourself, you know? For the last couple of months, I haven't been on social media. They say, "Hey, to Dr. Show, you need it for your business." I'm like, "Ah, do you know what? I can't deal with this right now. I need to be careful about what I'm putting in my mind. You know what? I've literally just, I can't deal with it, you know? And I've just stopped doing social media. So, be kind to yourself. Extend yourself grace. Listen to your body. Know what it needs, and listen and do what it needs. I think that's probably the biggest thing I'll take because our hormones will change over time. But if you remain sort of listening to your body and being kind to yourself and getting the help that you need, then it will serve you well.
Fantastic. If I can bookend that as well, one of the things I say when I'm talking to men is that if you were reading this story in a paper, you would be kinder to the character in that story. But when it comes to yourself, you don't apply the same level. So I think we've mentioned grace a few times. Please give yourself grace. You know, nobody's perfect, and we're all striving to be better. And this conversation is about us helping you be healthier, specifically as it pertains to women's health through life. So, Dr. Itunu, thank you so much. What a wonderful, wonderful talk, wonderful conversation, wonderful interaction. For everybody who's listening, this has been great. I think it's important for you to make sure that you share this information. Find the YouTube or the LinkedIn or Facebook and send it to somebody, send it to women in your life because we need to get this information out there. Thank you very much, Khan. And I'm going to hand over to Ashanti to close the session.
Thank you very much, Dr. Aya. Thank you so much, Dr. Itunu. It was absolutely wonderful. I've learned so much. The talk about the balance that we need to have, the conversation we need to have between men and women, really poignant, really current. And it was a very, very informative session. So I'm going to take us through what Khan has coming up, what you can sign up to. Let me quickly share my screen. Let's hope this all works out. Okay. Hope everyone can see it. Give me like thumbs up. Can? Cool. Right. So this health hour, we're so grateful to the doctors that give their time, their expertise, for the community. It's such a wonderful initiative and it's recurring. So we have it, every Saturday, same time. And we're really excited to be having one again next week. So, holiday season's coming up. People are gonna start, small chops. It's gonna be quite nice, good foods. So please do, pop in, look at our new one coming up with Dr. Jedediah about the festive season, how to enjoy that food with some moderation. So do register as well, same kind of process. Please share with, people in your circles, anyone that you think this would be valuable for. It's going to be quite a good one, I imagine. We're also having a Rising Together conference for the North of England, a leadership conference that's coming up in February next year. It's slated to be a really good day. So again, this is about registering. We want health professionals. That you can see the criteria on the screen. Anyone that that fits the criteria. Anyone that would really enjoy and get something out of the conference, please do register. It's going to be in Manchester. It promises to be a really good time. We also have in Cannes, we run something called Be Hip. So it's a Black health improvement and program. And basically, we're doing loads of cultural online training for primary care staff in Enfield. And we've been talking today about having that kind of cultural understanding and how that can affect our understanding of, things of illnesses and so on. So we want to have our doctors really clued up on these things, our primary healthcare professionals. And so anyone that you know in Enfield, again, please do share, let people know, get people get involved. It promises to be, you've gone a bit too far, promises to be a really good initiative. And of course, the contact details are on screen, QR codes also on screen. We also run a green and arts wellbeing services. Getting in touch with your creative side is really important. Dr. Itunu today talks about self-care. Please do get involved. It's in Bolton every Wednesday, Stockport every Tuesday. It promises again to be a great time, fun, art, and as we said, new friendship. Contact details on screen, QR code on screen. And finally, we have our Black Community Health Forum in Enfield. This is so important. It's bringing people's voices together to really create and impact change. You get to really have a direct influence on healthcare policies and services and make those valuable connections with community members and healthcare professionals. So again, it's a matter of knowing anyone in Enfield, please do share. It's free to join, the QR code's there. Please do contact Stephanie if you have any detail, any questions that you want to ask. And great events, and I think also amazing meetings. So with that, that's all. And thank you very much for joining us today. Thank you so much to the doctors, and we really hope to see you next week.
And that's our time for today. Whether you joined us on Zoom, Facebook, LinkedIn, or YouTube, thank you for making the Health Hour part of your Saturday. We hope today's session gave you the right dose of health wisdom that you can share with your friends and family. When we share knowledge, we strengthen our entire community. Mark your calendar. Next Saturday, same time. Got a topic in mind? We want to hear from you at health@can.org.uk. Health Hour, hosted by the Caribbean and African Health Network.